Hi, I'm Dr. Mahboob and MD Ophthalmology from AIIMS New Delhi, and I have this is what we are going to study today is Introduction to the Retina. Before we start, I must tell you this retina is a very interesting topic. If you learn the basic, this is very important for the MCQ point of view, the knowledge point of view, obviously, and I will try to make you clear the concepts of this retina as much as possible and as beautifully as possible. So starting with this retina, starting with the anatomy of the retina. So this retina is what the first important line, that is the innermost neural coat of the eyeball. This is an important MCQ. This is an important MCQ that I have asked. What are the other coats of the eyeball? So we have the three coats of the eyeball. The first one being the sclera, the outermost. Then there is a choroid, and then there is retina. That's why this is the innermost neural coat of the eyeball. Now, how many layers of the retina do you know? Yes, it is the 10 layer. 10 layers of the retina, you know, right? Now, what is this? This layer of retina, what I have divided it into the two parts. Retinal pigment epithelium, also known as RPE, which is the outermost part, and the other 9 is the neurosensory retina, that is rest 9. Coming to the next point, that's RPE. This RPE has no role in the neural transmission, and that's why it is not included along with this 9-1 neurosensory retina. But this is not at all. There is one another anatomical and embryological difference, that this retinal pigment epithelium develops from the outer part of the neuroectoderm. This retinal pigment epithelium develops from the outer part of the neural ectoderm, and this neurosensory retina develops from the inner part of the neuroectoderm. Got my point? And because of this embryological difference, there is the space between these two, RPE and the neurosensory retina. And this space is the space where the fluid accumulates and causes retinal detachment. So one of the important things that you should understand from this only is that retinal detachment occurs between by the separation of this retinal pigment epithelium and the neurosensory retina. So there should not be any confusion in this. Okay, the next line is RPE has no role in the neural transmission. Then what is the role of the RPE? The role of the RPE is metabolic pump, that it has a sodium potassium ATPase pump. Yes, let me write sodium potassium ATPase pump. It has sodium potassium ATPase pump, which is important for pumping out the fluid in between the spaces between these two and maintaining the retinal attachment, right? Coming to the second point is that it provides nutrition to the photoreceptor. Nutrition to the photoreceptor is very important, and it is because of this RPE. Next slide. So can you see, this is very beautifully given the picture of these things. Now this is very important to understand. These are all layers. So let me tell you what is this. Okay, so starting from this outermost area, this is the retinal pigment epithelium. So this cells is the retinal pigment epithelium. This is the cone. Why? Because of the shape is conical. This is the rod cell because of the shape is rod, cones, rod. So this is having the cone pedicle. This is rod spherules, the contents I'm talking about. Okay, so the second layer is that photoreceptor layer. Photoreceptor layer is nothing but the outer segment of this cone and rods has the different parts, and in the photoreceptor layer only the outer segment part comes. Got it? The junction of this outer segment and the inner segment is forming the outer limiting membrane, And mind it, this outer limiting membrane is not a true basement membrane. So it's because obviously this is not the end of the cell, this is the between cell. That's why it's not an outer limiting. This is fenestrated, one important thing you can remember. Now what is this? These are the cell bodies of the rods and the cones. So this cell body of the rods and the cones are forming the outer nuclear layer, means nuclear layer forms the cell bodies. Got it? So this photoreceptor, outer limiting and outer nuclear, this three layer is formed by only this rods and the cones. Got it? Plexiform, where the plexus is formed. And how does the plexus form? Nerve plexus kaise bante hain? Because of the synapses. So what the synapses you are looking here? This is the synapse of this cone rod, means photoreceptor cells with these cells. What is this cells? This is bipolar. B for bipolar. Bipolar cells. What is this cells? Horizontal cells. So this is this outer plexiform is formed by this synapses of this bipolar and horizontal cells. And what is this horizontal cell is doing here? They are giving the lateral side, and that's why they can cause the lateral innervation. This is the function of horizontal cell. The third thing is inner nuclear layer. Outer nuclear layer is formed by the cell bodies of the rods and the cones. So inner nuclear layer is also formed by the cell bodies of something. And what are that something? This is the bipolar cells, molar cells, M for molar cells, and horizontal cells, and amacrine cells. These four cells forming the inner nuclear layer. Now inner plexiform. Simply the synapses form the inner plexiform layer. Inner plexiform because of this cells. This cell synapsing with this cells. What is this cell? This cell is nothing for G. G for ganglion cell layer. Here, ganglion cell layer. Got my point? Now what is important of the ganglion cell layer that you have to know that it is single layered peripherally, means all around the retina it is single layered. But paraphobially, around the fovea, it is 6 to 8 layer. This is characteristic of this. Now can you see this? This ganglion cell layer is giving the axons here, and it is becoming parallel. Can you see this? So this parallel arrangement of the axons of this ganglion cell layer, this parallel arrangements of the axons of this ganglion cell layer form the nerve fiber layer. This is also an important question, important MCQ. So now you know, and the uppermost portion is internal limiting membrane. This is ILM. This is internal limiting, the 10th layer. So this is all about the retinal layers. Got my point? Now coming to this some MCQs. This blood retinal barrier is formed by, let me show you. What is this? This is molar cells. If you can see it closely, this molar cells is extending from here to here, means all around the neurosensory retina. So this is the longest cell of the neurosensory retina, you can say, and this expands from all the cells. So this is the glial cells, one of the glial cells, one of the supporting cell. And why we are calling this? Because this is forming the blood retinal barrier. So what is the answer of this here? It is molar cell. So it is molar cell. Second question is function of horizontal cells. I have told you, just see here, this horizontal cell is giving the lateral side, so it causes lateral innervation. The third question is function of amacrine cells. Can you see this amacrine cells? This amacrine cells is actually also giving the lateral things, but it is the function is negative feedback inhibition. Negative feedback inhibition. So this causes the negative feedback inhibition. This line is very important because I have already shown you the retinal nerve layer, fiber layer is constituted by the axons of ganglion cells. So no confusion is that. Why? Because this ganglion cells parallel arrangements, it's also important parallel, the axons is forming the nerve fiber layer. Got it? The retinal nerve fiber remain unmyelinated until the lamina. This is lamina. Okay, this is lamina cribrosa of the optic disc. So whenever from this this nerve fiber layer goes behind the optic disc, and when it reaches the lamina cribrosa, they start myelinating. So we can say that it remains unmyelinated till the lamina cribrosa. No confusion in that. The important thing to understand between the rods and the cones, the sum of the differences that they will ask. Obviously rod are rod type and cones are having the cone type conical shape. But the important difference is that it is 120 million and it is only 6.5 million. Maximum at the optic disc. Around the optic disc the rod is maximum but absent at the fovula. It is maximum at the fovula. So this is very important. Scotopic and photopic vision. Okay. Moving to this important point to understand. This is the normal retina I am talking to you about. Can you see this? This is what? This is the vein because it is something dilated. And this is what? This is the artery. This is disc. And what is the, what is the Pigment? So 1.5 millimeter. So this disc diameter is 1.5 millimeter. And the distance between the temporal margin, this is the temporal side, this is the nasal side. So it is a left eye disc because disc is on the left side. So left eye fundus photo, and because the disc is on the left side, one. And second thing is that from the temporal region, temporal margin till the center of this macula, we have 2 disc diameter. This is an important question, that is 3 millimeter. 1.5 into 2 is 3 millimeter. Now coming to this macular region, can you see this blue region? Blue region is 5.5 mm, right? No confusion. This is this region is the central part of this. In the center of the macula, that is the fovea. Fovea is 1.5. This is 1.5. Now in the center of this fovea, there is one called fovula, which is only 0.35 millimeter. That is 350 micrometer. What is important? No rods, I have already told you, and highest cone. Okay, so this is about the normal fundus. That is very important, and I have talked only about the relevant points. Coming to this blood circulations, retinal layers having the two blood dual circulation. One, as you can see here, that is the 6th layer, inner 6th layer and outer 4th layer. So inner 6th layer is formed by the supplied by the central retinal artery, which is a branch of ophthalmic artery. Outer 4th layer is supplied by the choriocapillaries, which is a branch of the short posterior ciliary artery. Okay. Now coming to this central retinal artery, so let me draw one photo for you. That is, if you know this one. So the optic disc on the right side. So this is the right eye fundus I am drawing. This is optic disc. So this is, macula, plus is macula is the normal notation. This is disc. So central retinal artery, when enters into the retina, it splits into the 4 quadrant, 1, 2, 3 and 4. Sometimes there is also one of the blood vessels. So this marking I have shown you, it is nothing but cilio-retinal artery. It is nothing but it is cilio-retinal artery. This is cilio-retinal artery. This cilio-retinal artery is a branch of short posterior ciliary artery. So this cilio-retinal artery is also the branch of the short posterior ciliary artery. So this is sometimes in some patients you will find this circulation also. Because we were talking about the blood circulation, that's why it is important to mention this cilio-retinal artery here. Now this central retinal artery and this choriocapillary dual circulations anastomose around the optic disc, and when anastomosis around the optic disc, they form a circle, and this circle is called circle of Gide and Haller because of the anastomosis around the optic disc from the above 2 blood system. And important point to understand that the centermost point of the macula. So what is the answer? It is very important. They have asked you in the examination, that is, it is AMBO. So this concludes the important anatomy of the retina as far as the MCQ is concerned and the knowledge obviously is concerned. Next class will be on, or the next lesson will be on the investigative part. Okay, we will discuss the fundus fluorescent angiography, OCT, ICG, okay, and fundus photograph, and obviously the direct ophthalmoscope, indirect ophthalmoscopy. So do watch all the lessons. It's very important to understand about them. Thank you very much.